So I want to thank you, Heather, for the introduction that you've given and for inviting Linda and me to be present today. As you know, we're going to be talking on living with neuropathy and chronic pain. Before we get to that, though, I just want to give you a little bit of background about this Calgary Neuropathy Association and what we do. We are the only active neuropathy organization in Canada, and we offer education and support. We give presentations like this. We want to raise awareness, and we also want to promote self-management strategies. We hold monthly meetings with guest speakers, alternating with support group meetings. And they are, since COVID, they're all via Zoom now. Linda has been working on our website for 8 years. We have a new version that's just been released. So we really encourage you to check it out. And we welcome you to our Zoom meetings. So if you go onto the website, you just have to make a click and you can be part of one of the Zoom meetings. We are 100% volunteer. We rely on membership, which is $25 a year, and donations. We're starting to look at grants and that, but primarily it's memberships and donations. And we have a goal of wanting to support research. And we have a great relationship with Dr. Sakotny. He's a neurologist from the University of Alberta. So the plan for today is to give you an overview of what neuropathy is and what peripheral neuropathy is. We're going to talk about neuropathic chronic pain that is typically associated with it as well. We're going to go through what the medical and integrative communities, what they're providing right now in our healthcare system. But our primary focus is going to be self-management. The strategies that you can do for yourself. I do need to read a little quick disclaimer, so bear with me. While great care has been in organizing and presenting the material, please note that it is provided for informational purposes only and should not be taken as medical advice. The statements have not been evaluated by Health Canada. The products mentioned are not intended to diagnose, treat, cure, or prevent any disease or illness. That said, it has been vetted by people at the Chronic Pain Center as well as Dr. Sakotny himself. So what is neuropathy? Simple definition is it's nerve damage. It can affect the motor nerves, the sensory nerves, and or the autonomic nerves. And Linda's going to talk about those in a few slides. The nervous system has two parts. It's got the central nervous system, which is the brain, and the spinal cord. You can think of things like MS, multiple sclerosis, Parkinson's, Alzheimer's, ADHD. Those are central nervous system conditions. We're going to talk about peripheral nervous system conditions, and they involve all the nerves that come off the spinal cord to the rest of the body, to the skin, to the muscles, to the organs. There are over 100 causes of peripheral neuropathy, and no matter the cause, the treatment is relatively the same with a few exceptions, which I'll get into. Now, we're also going to look at the chronic pain aspect. With neuropathy, it's referred to as neuropathic pain. And chronic pain is described as pain that goes on longer than the anticipated healing time of the illness or the injury that occurred. So we're talking between that 3 to 6 month mark when an injury or illness should have healed up and shouldn't be painful anymore. That is called chronic pain. The pain signals are still active in the nervous system, and it can go on for months or years.
This is a list of common conditions that cause chronic pain. I've highlighted nerve damage, migraines, and other headaches that typically falls under the central nervous system, same as what Sylvia had talked about, the other things. But all of the other things on this list can also cause nerve damage. These are just some of the most common causes of peripheral neuropathy. There are tons of others. Some of them can be quite rare, but about 1 in 5 people will get some form of neuropathy, peripheral neuropathy, in their lifetime. Some can be cured, like carpal tunnel syndrome, for example, but really most can't. And in the bottom right-hand corner there is idiopathic. That basically just means they don't know what's causing it. They've looked and they can't find anything. And that's 30 to 40%, which is quite high actually. Chronic neuropathic pain affects an estimated uh, 1 in 15 people in Canada and North America. Truth be told, the numbers aren't solid because they don't track it that well. It does typically affect older adults, but not always. My son has it, for example, because ours is genetic. Diabetes is the #1 cause in the Americas. Chemo-induced is a close second. And in the developing third world countries, there's regions where leprosy actually is a #1 cause. Now, you can't get that in Canada. You can get it in the States, but it'd be very rare. And the only way that I could find was from handling armadillos. So stay away from the little guys. Neuropathy symptoms really depend on the type of nerves that are being affected. So the sensory are things like burning, like the lady with her calves, tingling, shocks, numbness, bugs crawling on you, cold water running down your leg, or cold actually feeling like it's burning. Motor nerves, those are things like the muscle twitches and cramps and weakness. Often there's poor imbalance that goes with it and no reflexes or poor reflexes. Now, nerves obviously can go everywhere in the body, and so anywhere can be affected. The sensory and the motor nerves, those are kind of obvious. We have actually a resource on our website called The Language of Nerve Pain, and that helps people describe the pain, because going to the doctor and just saying, well, it kind of hurts, it kind of burns, isn't really sufficient. And those two are the two that are really usually worse at night. Some people have it worse bad all the time, but usually still worse at night, which causes sleep problems. Autonomic now are not as obvious, but that can be any kind of organ dysfunction. So think about your diaphragm, your GI disturbances, so bladder, bowel, that kind of thing. Cardiac, so impaired control of your heart rate, your blood pressure, often lightheadedness, fatigue, and even vision and hearing disturbances. I have some hearing disturbances because of my neuropathy, for example. I'd like to take some time to put that into perspective, the kinds of pain that there are. So this is the McGill Pain Index, and it uses information from the McGill Pain Questionnaire. And the purpose is to quantify and analyze a person's pain, to get an understanding of the nature and the intensity of the pain. Oh, fun. I'm going to just zoom into it here. And top of the list is complex regional pain syndrome. Also ties in with regional sympathetic dystrophy. So that is a neuropathy. Trigeminal neuralgia is also a neuropathy, and that's coming in at 44, and that's in the face. Now, if anybody's ever had kidney stones, they know how painful those can be. I haven't, but I've seen it, and it's not pretty. Now my arrows start going funny, so I'm just going to click through them and go back. So childbirth without training comes in at a very unpleasant 40. Childbirth with training comes in 5 less at 35. And phantom limb pain, so if you've had an amputation, that comes in at 25. And anybody who's had shingles knows how painful that can be. That's that coming in at 22, and of course that lingers sometimes for months or years. So that hopefully that puts it into perspective that neuropathies they're not all up in these areas, but they can range anywhere, and it's very uncomfortable for most people.
We're going to move into what the commonly prescribed treatments are by the medical community, integrative healthcare providers. And we're going to refer to these through the presentation. What I want you to keep in mind is that the results are not to expect a cure, not to expect to be symptom-free. In general, there just isn't a known cure and there is no specific treatment. So the goal is to maintain or regain function and to have that quality of life. And we want you to know you can function with neuropathy and you can function with chronic pain. Now, there's always a few exemptions for a specific treatment, and one is with a nerve condition called CIDP, chronic inflammatory demyelinating polyneuropathy. And the specific treatment for that is an intravenous gamma globulin IV. It's called IVIG. They can also do blood exchanges and use corticosteroids for people with CIDP. The other one is kidney failure. So we refer to that as uremic. And dialysis and a kidney transplant are specific treatments for that. And the other is diabetes. And that's controlling the blood sugars and using the meds, whether it's insulin or oral meds like metformin. Those are specific treatments for those types of neuropathy. Now, we'll get into the first line treatments. And first is the analgesics. You'll notice that number 58 at the top in brackets. That is just in reference to our website where you can find more information. It's going to be under the 100 plus things that you can do for neuropathy. And I believe we're in the 80s now we've got done. So it's a work in progress. And you're going to find these throughout the slides. You'll see those numbers. So analgesics, they are painkillers. There is no magic pill for neuropathy. It will nothing to take away all the pain or the other symptoms that you may be having. I was fortunate enough to go to the first ever neuropathy summit in Washington, D.C. It was back in 2010. With my background, I was able to go to the physician conference as well as the patient conference. And when I was on the physician side, I heard this doctor talk about prescription meds and the expected only 30 to 40% pain relief from them. I was shocked, actually. In our society, we expect 100% relief. When it doesn't take away all the pain, then we tend to go back to the doctor, say it's not helping. What happens? The dose goes up. And it can become a big issue as it goes up and up and up. In particular, it happened recently with the OxyContin and the crisis that came from that. For years, the opioids were marketed specifically for neuropathic pain. However, with that crisis and misuse of opioids, it prompted reviews, and the proposition out of that came that opioids showed only small to moderate benefit for neuropathic pain. So doctors are looking at other medications and other treatments to help. The next one we're going to talk about is anti-epileptics. And that is medications used for epilepsy. They have now become frontline treatment for neuropathic pain. And we had a doctor, a neurologist, come and talk to us, and he was one of our guest speakers. And he explained to us, and he was rather quite dismayed when he said that the study for it with neuropathic pain was based on only 46 people. In Western medicine, that is not considered, it's just not considered to be good research. But some of the people found some relief, and the doctors went, okay, let's try this. And it has now become first line. The next one we're going to talk about is antidepressants. Now, there's a couple. They're just two different classifications, the tricyclic, and there's the meds that fall under that, and the SNRI, which stands for serotonin, norepinephrine reuptake inhibitors. And they just have different mechanisms of action. They both were initially used for treating depression. And over the years, they've shown to be effective in chronic pain. So they not only can help with the pain, but they are mood stabilizers. And how they work is they interfere with the chemical processes in your brain and spinal cord that cause you to feel that pain. And they are now first line for neuropathic pain. A lot of people find that they're helpful for sleep as well. So you got the sleep, the mood, and the chronic pain benefits from it. Analgesics, antiepileptics, antidepressants, those are the three main medication groups that are used to treat neuropathy, and they're also often prescribed in conjunction with each other. The next one I want to talk about is topicals. So topicals are medications that are applied locally at the site. They are not ingested, so you don't get that systemic effect, so there's fewer side effects. Topicals are available over the counter in low doses. You can get them by prescription. And for the stronger classes of medications that are regulated, you can get them through a triple script. So over the counter, things like Voltaren, oh, there's just so many of them. I'm not even going to name them all. But they're a base of capsaicin cream. And a lot of people find that's enough relief. You can go on to get in a prescription, or you can go to the other end of getting something like ketamine on the street that's known as Special K. But when it's prescribed and used medically and appropriately, people are finding that gives really good relief. Now, a little tip about using topicals is that you're applying it to the painful area. But we have on our website this photo or this picture of what we call dermatomes, and they equate to the nerve pathway from the spine to the part of the body where the nerve ends, where you're already applying it. So if you apply, sorry, I don't know if you can hear those lights and sirens of the ambulance and fire department going by. I apologize. But if you apply at the level of the spine that correlates with the nerve ending, you may get a boost in that relief. And like I say, more information is under neuropathy articles under topical compounds on the website. The next one we're going to go through is medical cannabis. So medical cannabis, the use is increasing all the time as more research is coming out supporting its effectiveness for neuropathy. Studies have shown significant benefits, efficacy in neuropathic pain. And what we have to caution here is that everybody is unique and the effectiveness is individual. 10% of the population won't even have the receptors for the THC to work for them. And it's a lot of trial and error. So we want to talk about the benefits of using the medical clinic specific to handling medical cannabis. Not only will they give you a great education around it, but they'll help you navigate all the suppliers, the providers. They'll help you navigate the strains, the turbines, all the technical aspects of choosing which one to use. They're wonderful for that. The other benefit is if you go through medical cannabis clinic with a prescription, you can claim those receipts on your income tax. There's multiple ways of using medical cannabis. You can have the drops of oil. You can smoke it. You can vape it. You can eat it. They refer to that as edibles. And you can use it topically, like we were just discussing. You can use those medical cannabis lotions and use it topically. Now, we do caution that smoking and vaping medical cannabis does have a damaging effect on the lungs. And we really strongly caution people to consider other methods of using it. Um, a lot of people, I know my first thing was when they approached us was, I do not want to get high and I don't smoke. I don't want anything in my lungs. And he says, that's why we want to come and do an education session. So what we've learned is it's not the THC, that's the component that gives you that high. It's the CBD, and now they're looking at other ones like CBN. Um, they're just research is coming out all the time. Um, so the CBD does not produce that psychoactive effect. It actually has very mild side effects even. It's been shown to be very effective for chronic pain, especially neuropathic chronic pain. But for the CBD to work, it does require a tiny bit of THC to activate it, but it is not enough to cause any high. For some conditions, like for sleep and whatnot, having a combination 50-50 ratio of THC and CBD is really helpful. And I encourage you to go to a medical clinic that specializes in medical cannabis.
Okay, so this is what I like to call the good news part. So we're going to talk about things that you can do that aren't medications. Now, don't get me wrong, medication is only one way to manage, but it is a very important way, but definitely not the only way. We advocate for what we call self-management. Sometimes you'll hear it called self-care or self-treatment. And really, self-management is about building your own personal set of strategies that make you feel better. And it's not just about the pain either. And there's a combination of everyday things that you can do. I have about 50 of those on my list. And also having a plan for a flare-up when it gets really bad. You already have one, even if you didn't know it. Coffee to fight fatigue in the morning, for example. Exercise. Hopefully you do that as part of your everyday. Wine or chocolate to cheer you up. That can be one. But you know, some of those things might be working against you. So to build your strategies, what you need to do is become an experiment with a test subject of one, all with the purpose of you understanding your neuropathy symptoms, and the impacts that come along with it. We certainly recommend that you try one thing at a time and develop your treatment plan over time so that you know, and you have to isolate that way so that you know which one is working. First thing, before we get too far into that though, I want to talk about the symptom cycle. And it's really just a fuller picture of what chronic pain looks like. So like I said before, symptoms are only part of the picture. The symptom cycle really emphasizes the other impacts that symptoms have on our lives. So those impacts can be just as life-changing, and really it's all connected. So I'm going to click us forward here. So if you have loss of function because of your neuropathy, for example, that's potentially leading to difficulty working or lower performance in activities that you like. Maybe that leads to financial insecurity, for example. Now you've got lower self-esteem, which is going to lead to stress. Stress leads to more pain, which leads to loss of function, which is going to make it even harder. And so you can see how it can cycle and cycle, just feeding in on itself. Breaking the cycle in one place helps. So if you can cut down the pain, you maybe aren't going to lose as much function, so you'll be able to perform better. And there's other ways too, like with the loss of function, you can compensate with things that an OT might provide. So with aids or other things. Myself, I use voice to text sometimes because I have a bit of a tremor starting in one hand. So talking about self-management, it works best as an integrative approach. So integrative really is defined as the medical plus the complementary, and putting the two together so that they support each other. The number one thing always is to manage your underlying condition. So for example, if your neuropathy is from an injury, fully embrace the rehab. If your blood sugars are high or you're diabetic, controlling those blood sugars. A B12 deficiency, controlling your B12. always, like I say, the underlying condition is first. An integrative approach looks at all the aspects of you and what you need and tries to address each. So behavior, cognitive state, social supports, very important, your physical state, medical very much involved in that, and even spiritual aspects. So some of these ones listed here are pieces of an integrative approach that can help with neuropathic pain and symptoms and the impacts, but again, only a small sampling. They can measure those energy, movement, and blockages. So they're beginning to do studies, and they're actually working towards making it evidence-based at some point, but it's not there yet. Okay, the nutritional supplements. I don't know about you, I did this just the other day. Standing in front of those shelves, like even at Superstore, and it goes from one end to the other of all supplements, and it's super overwhelming. So what we've done is compiled this list. It's the ones that we suggest the most commonly. Again, we're not medical people, but we have based this on uh, research studies. So not studies by the manufacturers, but actual research studies. And that's how we came up with this list. And they're on the list because they're shown to be neuroprotective in some way. So think about nerves like wires, and wires have a coating on the outside. The wire is the nerve, and the coating on the outside is what's called a myelin sheath. And that sheath actually is very important for speed of messages. So that's nerve and myelin. And this is, like I said, the ones that are neuroprotectants. Some of them work on the nerve and some of them work on the myelin sheath. Before you do any kind of new supplements, it's always good to talk to your doctor, though, in case there's any conflicts. Did anybody have questions on that?
We did have a request to make the slides available. So just to let everybody know, we are recording this. So it will be on YouTube so that you can stop and start and go back as much as you need to. I don't have anything specific to what you're talking to right now.
Yeah, we've kind of come up with a policy that we don't share the slides. That's for our guest speakers and for us because it becomes a whole thing. We could sit down and have coffee and talk about that, but we just don't anymore.
Okay.
So
And the information's on the website,
it all is, yeah.
calgaryneuropathy.com.
Yeah.
Okay, this is what the part we like. It's self-management. It's all about the care and the actions, strategies, tools that you can use for yourself to take care of yourself and to manage your symptoms. We always advise that you have more than one tool, one strategy. I was teaching in the Living Well program through the Alberta Health Services, which is a program out of Stanford, and it is available across Canada. In last I heard 10 years ago was like 64 other countries, so it's well established. But they do a big thing about brainstorming and making that list of different things that will work for you. Everything from gardening to meditation. The list can be anything that does help you. I keep my list on the fridge because when I'm in the middle of a flare-up, my brain doesn't work as well and I can't think of all those things. So really encourage you to make that list. You know what? Time for a break. We're going to put some of this all together and about what we've been talking about. Exercise we know is imperative at any level of ability, whether you're in a wheelchair or using a walker, you're standing, limited, there's exercise for everyone. And then when you complement that with positive affirmations, there's two strategies being used from your collection. What we're going to do next is these meditative exercises. That brings in another strategy. So Linda's going to show you the standing version or sitting version, and I'm going to get up and hopefully you can still see me because I have to move back. And we can do this We can do this together. Please just go at your own pace. I need to modify myself, so that's what you're going to see. So the first thing is just getting comfortable. And these are the words that I came up for me. And so just, you can do what you like for yourself, but this is the day to nurture myself. This is the day to nurture myself. This is the day to nurture myself. I am loved and I love others. 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 I give and I receive. 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 I am humble and I give thanks. I am humble and I give thanks. I am humble and I give thanks. I'm opening my heart to receive. I'm opening my mind to receive. I'm opening my heart to receive, and I'm opening my mind to receive. My mom shared a video called the 4-minute exercise, and I've adapted that to what works best for me. So I encourage you to do that as well. The goal is to do 10 repetitions of each. Obviously, I shortened that. But yeah, anyways, I like to start my day. I get out of bed, I do that, and it gets me going. If you joined us doing it, I'm sure you can feel that little tingly and you got your blood flowing again. And I hope you enjoyed that.
And I have to apologize. I stopped sharing the PowerPoint, but I forgot to stop sharing the screen. So we were little tiny postage stamps while we were doing that. My apologies. Okay, self-management is really about taking your care into your own hands. If you're new to this, the self-monitoring is really the place to start. You know, it's used to track your pain management, to track your pain and your well-being so that you can find patterns and you can find triggers, both positive and negative, because there are both. And then it helps you to identify where you want to focus your efforts. With that information, you can choose the strategies. And like Sylvia said, we've got, 80 some on the website and more to get built. And more importantly, really, or just as importantly, is you can provide that information to your doctor for a discussion. We recommend that people do the monitoring, though, as something changes or something is new coming up. So do it when do it for a purpose, I guess. Do it. You don't want to focus on monitoring your pain all the time, because that, I think, can go the other way and cause it to make it worse. But you'd still need to know. So if you have an appointment coming up, something like that is a good time to prep for it. So why is all this important? In the UK, there's a director then for the National Institute of Health Care Excellence, NICE for short. His name is Dr. Paul Crisp, and he and his team have put out a new guideline for treating chronic pain. And when he talks about it, he said, and I'm quoting him here, it highlights that achieving an understanding of how pain is affecting a person's life and those around them, and knowing what is important to that person, is the first step in developing an effective care plan and support plan that recognizes and treats a person's pain as valid and unique to them. And this concept is really becoming more and more better understood. And so slowly, very slowly, things are changing. But what it really means is you need to know how you are affected so that you can communicate it well. to not just your doctor, to your physiotherapist, to any medical practitioner, and even to your families. When you're in a doctor's office, they narrow down your concerns right down to what you're there for today, right? They have those short questionnaires sometimes that you fill out, or marking on the body if you're talking physiotherapy, say. It's real quick and easy, but really a more robust way to track the information for yourself that may be more accurate or clearer is having like a weekly or monthly, like a pain tracker of some sort. And not just pain, other symptoms as well. When you're in a doctor's office or physiotherapist, you're filling that thing in the 15 minutes they give you beforehand, and you're doing it all by memory. And I don't know about you, but under pressure, I don't always remember everything. So if you have a pain tracker, you can sort of summarize it and go prepared with a list of your concerns. Also prioritize them. A really good way is to do this is journaling. So journaling, you write it out. You write about your pain and your other symptoms. And it has a real added benefit, actually. It works for some people to ease their pain and the impacts. And it does that because when you put it down on paper, that creates a stronger brain-body connection. So it goes from the brain down the arm to the paper. And that releases chemicals in the body from the brain and reinforces new pathways. So you're going to learn different ways to respond to those old pain triggers. And all of this will help you see those patterns so that when you go and you can talk about it clearly and what brings it on, what makes it better. Now, of course, you can't hand over a journal to the doctor. So you're going to have to do some work with that one to pull out what's really relevant and what you want to talk about. So if you remember Dr. Chris, he said, what is important to the person? So if you're overwhelmed, it's hard to assess everything all at once. This Wheel of Life is really an example. It gives a really high level look at the components of our lives. And you can find many versions of this on the internet. You can make up your own if you want. But it's really to take home, see how balanced your life is or not, and decide where to work on it. So obviously you just sort of go around the circle and you put the dot and then you connect the dots. And where it dips way in, like here or here, those are the areas that you want to focus on. So this particular sample here is me back in 2015 or 16 when I first came to the Neuropathy Association. And then now this is what it looks like. So I think my health has improved, mostly because I'm managing it better, and I know how to deal with the pain now, and there's all kinds of reasons. And fun and recreation just didn't seem very important back then. I was so focused in on how I was feeling and what was going on that now I realize how important it is and that it's coming out. So doing it over time, you can see improvements, hopefully. So I want to circle back to that mind-body connection again. If you release tension, you're going to relieve pain. And you can do that through relaxation exercises. We've got some examples. I mean, you probably know what some of them are. Deep breathing, body scans, things like affirmations like we did earlier. Tapping, which Sylvia is going to talk about in more detail, is a really good one. Self-hypnosis, mindfulness, and other types of meditation. Even art and art therapy, drawing without judgment. It's all ways to relax. Again, they help release helpful chemicals in the brain that relieve tension and stress. And that all causes inflammation, which adds to the pain. And they help build resilience. Now, I flagged deep breathing as the simplest one. It's one of the best ways to calm down the stress response in the body and the pain response in the body. We had that from a pain specialist who came to talk. It increases your oxygen level. And if you remember the three things, oxygen, nutrition, and stimulation, it does that. It increases your oxygen. And building resilience, that's the ability to withstand and recover from difficult conditions. If you look up, say, ways to build resilience, you'll find the Mayo Clinic, Berkeley's Greater Good, and the American Psychology Association. They all list these kinds of activities to help you build resilience. And of course, you can take it anywhere you go. It just kind of happens. Okay, another mind-body strategy is meditation. So pain is complex and it is centered in the brain. Taking advantage of our brain's ability to change, that's something called neuroplasticity. You can actually turn down the volume on your pain. Now, I know many of you are probably meditation skeptics, because I sure was, and I'll tell you why I converted. We had a guest speaker. Again, it was the same pain management specialist. She told us that back in '96, there was a Canadian researcher that uncovered that what we used to think that pain was felt at the site is completely wrong. It's not felt at the site. It's actually processed up in the brain, and the brain controls it all. So with neuroplasticity, people can, again, turn down that volume. They change their brain and they ease their pain. Pain is a positive, what they call positive neuroplastic change. Just a few little stats here. A normal brain without chronic pain dedicates about 5% of its energy to dealing with pain. Now, a person who is dealing with chronic pain, that poor brain is using 25% of its energy in dealing with pain. Results in cognitive fog, or often called brain fog. People get easily emotional. They get easily stressed. And the reason is that pain is taking away from the emotional center in the brain, and it's hijacking that higher processing. So I know when I first started meditating, and it was Sylvia who got me into it, I could tell that I was less emotional. I was much easier to handle crap at work and stuff like that. And I knew within a couple of weeks that it was working. So meditation practices, it doesn't have to be sitting on a cushion, just sitting and breathing. It can be visualization, things like Qigong, Tai Chi, prayer, any kind of meditative practice. There's just a ton of them out there. Now, I am a prove it kind of gal. So this slide is a woman who lives with lupus and was having a flare at the time of the scan. So she had also had 8 weeks of meditation training prior to having this scan. And so after they got a scan, they asked her to start meditating. And this was the difference. All that noise in the brain from the pain just flaring uncontrolled went pretty crazy, as you can see. And then here you can see how much it really toned it down. And that was with only 8 weeks of meditation training. And myself, I just did it by reading a book and following what it said. So if you want to learn more about pain and the brain, you can look on YouTube, look up physiotherapy, Dr. Mortimer Mosley for more, or sorry, over here. And he's got one, the latest one I saw was from May last year. It's called The Pain Problem, but he's got a whole bunch of videos up there. And so does anybody have any questions on this stuff?
Sorry, I'm just taking notes to make sure that we add all of this into the description in the YouTube and send it out with that email. I Not so much questions right now,
Lots
but
of
I
comments.
will reiterate kind of what you said about the doing uh, the yoga and the meditation. Um, we have online classes here, and one of the ones that we have right now is a yoga class, and I'd had a number of students because we work with seniors, and they said I did not like yoga. I thought it was, hokey and whatever. And they said, but I tried it and I had no idea. I feel so much better. So yeah, even if it's not your favorite thing, it does actually have an impact. And I'm going with quotes from our students who thought it was weird. So
Yeah. Yeah, believe me, I thought it was much too woo-woo for me until I actually did the meditation part. And I do yoga now as well, although I kind of fallen off lately, but it's something you can just pick back up. And there are lots of online ones. If you'd like, I can send you a link to a couple of free ones as
perfect.
well.
We'll make sure that that gets included in
Okay.
the email to everyone. So we're coming down on time a little bit. So how much more do we have? How many slides do we have left?
Probably about 15.
Okay, so anybody who is not able to continue with us, we are recording this, so we'll make sure that you get the link to the recording. If you're able to stay with us, I encourage you to stay, and we'll keep going.
Well, that discussion leads great segue into tapping, which is even less common than meditation and yoga. But tapping brings together the strategies of deep breathing, the mindfulness. It brings the mind-body connection. It soothes the autonomic and the vagal nervous system. It sends calming signals to the amygdala, and which Linda had showed you the benefits of with the meditative aspect on that MRI. It also releases endorphins, which help to alleviate pain. And it helps us to shift our unconscious beliefs and emotions as chemicals are being released that help bring us into balance. So this next slide is just some research and the significant impact tapping can have on different aspects of your body. The benefits of tapping, I did a little research on that. Like, okay, how long do you have to do this for? So there was a study that compared the benefits of tapping to the benefits of cognitive behavioral therapy, counseling. And after 1 year, tapping was found to have a 78% benefit and continuation over the CBT therapy, which was at 69%. And now there are over 200 clinical trials and studies that are in peer-reviewed journals. So that makes tapping an evidence-based practice. Going to just go briefly about communication because you can't see neuropathy, you can't see chronic pain. It's unpredictable in its nature. If anybody's ever said, well, you were fine yesterday, well, yeah, well, today I'm not. So it's important that we are able to communicate what our needs are at the moment, at the time. We acknowledge, and I've said this before, that you need to know about your condition. You need to be an advocate for yourself, that each person does have a responsibility to be knowledgeable about that condition, to be able to engage in communication with your healthcare providers, all of them. You need to be willing to participate in your own care and your own decision makings with healthcare providers. We actually talk to healthcare providers. We encourage this within the healthcare system. We also need good communication when we're talking to family and friends and coworkers. Explain it to them, help teach them about the condition, rather than just talking in what comes across as complaining about it. Do ask for help when you need it. When others want to help, they don't always know how, they don't always know when. And by accepting help, you're actually doing something really nice for that person because they feel good that they've been helping you. Going to talk about pacing. I'm the worst person to talk about this as it's very difficult for me. I'm kind of going all the time. But the best part about pacing that works for me is planning ahead. If I want to do a big activity, then I don't make plans for the next day or two, or sometimes even three. Listen to your body. Often the symptoms don't show up for 4 to 6 hours later. So you need to understand that ahead of time as you learn your body and how it responds. Set your priorities, let other things go or delegate them. And again, exercise is important. Start off slow. Start off at 2 to 3 minutes even. Do that 2 or 3 times a day. The goal is to work up to 30 minutes a day, but you can break that up as to how it works best for you. And I think Linda mentioned this earlier, but fill in those moments. Fill in the moments like when you're standing in line at the grocery store. Do some ankle rotation, scrunch your toes up, do some deep breathing, that kind of thing. Every time I see a red light, I do my deep breathing. And I think that everybody should do that, and there might not be so much road rage. The other thing, I'm going to read some of this because it's about self-talk, and I introduce you to a Dr. Christina Briardo. She's a naturopathic doctor, and she wrote, thought, just a thought, create neuropeptides which bind to receptors in our brain and body, and it influences our physiology. And this is from a book called Beyond the Label. She goes on to explain that the thalamus perceives thoughts as real stress, and the body prepares to flee. It increases our breathing, our blood pressure, our heart rate speeds up. So when you have a negative thought, it actually changes hormones, your norepinephrine and your cortisol levels. It upsets, or this upset in the hormonal balance, it actually depletes chemicals required for happiness, and it can cause damage to the immune system. It produces more white matter in the brain, which disrupts the neural connections. That affects our mood, that affects our anxiety levels, depression, and ultimately it impacts the pain that we live with. So going on about the negative thoughts, just a thought, I'm going to challenge you over this next week to just note how often you have a negative thought. And what we hear often is that people will notice it in others a lot easier than they notice it in themselves. But when you are mindful to this, I want you to take that negative thought and immediately change it to a positive thought. Ideally, bring in that mind-body connection. Ideally, write it out like it is on the slide, which we need to get to that slide yet. There we go. It can be something as simple as, I just can't do it anymore. Negative. Change it. I can do a little bit at a time. And if you can't exactly do it the way it was, well, then try to find something else to replace it or modify how you do it. It's just getting the positive thinking going. It's getting rid of those negative thoughts, getting rid of the word can't. I couldn't downhill ski anymore. So I bought some cross-country skis, and then I had another accident and I could no longer cross-country using my arms. And I ended up buying snowshoes. I can still get outside and enjoy the outside. Enjoy the outdoors. So I like to read this. It's called The Thought That Counts. Watch your thoughts because they become words. Watch your words, they become actions. Watch your actions, they become habits. Watch your habits, they become a character. Watch your character because that becomes your destiny. That was written by Frank Outlaw in the Interaction Cycle. Go ahead, Linda.
There's lots of changes that you can make, just little lifestyle type changes, right? This is a small sample here, and I know that this list seems obvious, and everybody says these things, but all the same things that are important for others are more so important for people who live with peripheral neuropathy or any kind of chronic pain. If you think about your nutrition and your meals, managing any kind of food sensitivity that you have, using an anti-inflammatory diet. Some people, it's enough that they're absolutely amazed at how big a difference it can be. Exercise, I know we keep harping on it, but we're not necessarily talking about cardio either. Stretching, doing nerve glides, where you're moving the nerve up and down through the arms and legs. Balance training is very important because we're prone to falls. Same with strength training. And even hand and feet focused exercises are very important. Sleep hygiene, there's 50, 60 different kinds of things that you can do to make your sleep hygiene better, to help you get to sleep and get more sleep, because we know people with peripheral neuropathy have problems there. Even the simple little things, how many of you have your legs crossed right now? Well, you're putting pressure on the nerves on that lower leg and even maybe on the upper leg. Leaning on your elbows, all those kinds of things, little tiny things that you can change. And a big one, our posture in North America these days is not very good. So try straightening up, because you're compressing the nerve root where it's coming out from the spine. And it's an easy fix for some. Okay, here we go. So again, remember 3 things to maintain the health of your nerves: oxygen, good nutrition, and stimulation. All movement stimulates your nerves. It doesn't matter what you're doing. Even small moves do. So those small muscle groups are important. You think about working your hands and doing just tiny little exercises to keep those fingers moving and limber and building strength in them. When you're talking about moving muscles and strengthening muscles, please don't jump to like heavy weights, because what's going to end up happening, especially if your muscles are already weak, is you'll get cramps and you'll get pain. Really do lighter stuff to start and work your way up. You might want to get a trainer or something like that, or a physiotherapist. Who exercises their feet? I'm thinking not that many people do. We don't often think about feet exercises, and this can include the ankle. Exercises for your feet build strength, reducing risk of fall because you're improving balance. You can ask your physiotherapist or other health provider. We do have a sheet that you can find. I think you search on our site for hands and feet, and there's a sheet that you can download to get you started. And honestly, even doing little exercises and building a little bit of strength really gives a person a sense of empowerment. It certainly does for me. So this circle is representative. It's just an example. Not everybody's going to get results like this, but of combining strategies. So we talked right at the very beginning about having the medical and the complementary approaches. So medical being, whatever you're getting from the system. So your meds and your topicals that you can get. But by doing multiple things, you're more likely to notice the relief that your symptoms are going to have. Now, not everybody's going to get 100% relief, but you will get some. And this concept, we've got, four bigger things here, but really if you had 20 or 30 littler things, that works as well on the complementary side, just to help relieve those symptoms. It shows that multiple strategies can fit together into one self-management plan. And that's sort of our goal, was for you guys to go away with the idea of a self-management plan in your heads and thinking about how you can build one. Only an example. Okay, so our resources, calgaryneuropathy.com. In the States, there's also a Foundation for Peripheral Neuropathy. They're a big organization down there, and a Western Neuropathy Association. Here in Calgary, that chronic pain support and connections group, Sylvia is a part of their board as well as ours. And they have a nice little team there. Okay, so we have monthly meetings every third Wednesday of each month from September to May. We're sort of in a transition period right now. We were doing it every month, but it's becoming too much for me as my conditions progress. So we're going to every second month, and then with the connections, that's our support type meetings. They'll be, well, we're still trying to figure that out, but we'll still have some.
We just want to thank you for joining us today, staying with us a little longer as we talked about peripheral neuropathy and chronic pain. We hope you learned something new today, or maybe it was just a review. If you have any questions, feel free to contact us. We have some time right now to answer a few. But we look at this as just the beginning, seeing a new way to manage your symptoms and enjoy your life, regain your life.
Do you have some questions? Um, so I'm going to go back to that one that from the very beginning. Best way to manage burning calves was the specific question.
Mhm.
But yeah, the best way to manage, I guess, something that's happening on a regular basis in a specific part of the body. Um, Suggestions on that?
Well, because it was a specific part of the body, we kind of recommend the topical because you're focused in on that area and you're not getting the side effects from the medications that are, going to affect the whole body. And I picked out, I think I responded to that and said some sort of topical cream. And Sylvia talked about our topicals. And if you need to go to the doctor and get a triple script one, that's perfectly fine, right? And then if that isn't enough, putting an oscillating fan so the sensations that those calves are getting are constantly changing. So one thing we didn't mention in the presentation was that your nerves can only send one message at a time. So if they're burning, it's because the damaged nerves are randomly sending these messages and it they're just upset at the moment. But you can curb some of that by putting on like a peppermint, a menthol, or a heating, like with the capsaicin, or there's other ones as well. And then the oscillating fan just sort of multiplies that because it's going to make the lotion or whatever you're using on your legs sort of go cooler as the fan goes. Other people have found that really can help. And now it's a short-term solution, obviously. And my internet connection is having problems, so that might be those solar flares.
Yeah, there you go. Actually, if you just turn off your video, that should probably help with the audio.
Okay, I can do that.
The other thing I'd recommend is slow stretches for the calves throughout the day, especially at nighttime. Just nice, gentle, very gentle, but stretch your calves out.
That's good. Okay, so next question is how do you find an appropriate trainer? And how do you explain your needs to them? So, I mean, even with myself, I got a trainer and he was in his 20s and he really didn't listen. So, and they push and they push and they're like, oh, it's all about pumping. Like, how do you have those conversations and how do you find a trainer or explain to somebody who doesn't understand what you actually need?
That just comes down to communication skills,
Okay.
and
There,
trial and error. There's, it not even my example is trying to find a physiotherapist that specializes in RSD. It's the reflex sympathetic dystrophy that I have, and it falls under the umbrella of that chronic regional pain syndrome. I can't just go to any physiotherapist.
Hmm.
So I ask,
Yeah.
I
Okay.
have that. Do you have experience working with this? Do you recommend do you have anybody you'd recommend? And it's not just asking the therapist, but asking other people that are going to therapy. So it'd be the same as with a trainer. You just have to ask, you have to explain the situation. And if they're not getting it, they're young, they're not getting it, that's okay. Ask.
Take the opportunity to educate them. I
Yeah.
Yeah.
had I had a, athletic therapist. So but she was basically a trainer, and I had her for a while. And I would explain to her, I need you to go look up Charcot-Marie tooth disease, which is what I have, or peripheral neuropathy, and understand where I'm coming from, why I'm having these problems, and why I'm different from your other um, clients.
Okay. Um, the last one that I've got here is setting realistic goals. And how do you let go of what you used to be able to do? And you talked a little bit about that with the downhill skiing to the cross country skiing to the snowshoeing. Um, it's it's not just making those changes. Making those changes is hard on the ego. It's hard on your identity is changing. So do you have any suggestions or tips or tricks to um, kind of come to grips with or to terms with what the new normal is and finding enjoyment?
I found it extremely humbling.
Yeah.
I didn't go to school for all those years to get that education to not working, being on disability, and struggling financially. There's so many aspects of accepting that is difficult.
Hmm.
That's what our group is for. That's we encourage you to come out to talk about these things, to learn about these things from other guest speakers. I'm a big believer in finding a counselor to talk to. I do that periodically when things just get overwhelming, and um, there's not an easy solution to that.
Hmm.
Yeah.
So the best thing I can say is be positive and look at what you can do. Um, I just heard it on the radio the other day, and I always say this. In fact, I wrote a little article in that 100+ things on volunteering. Get outside of yourself and help somebody else. And you'll be surprised how much benefit you get from that that's why we volunteer, why we do this is because it makes us feel good. We know we're helping people. The feedback's been amazing, but it's also we do it selfishly for ourselves.
Yeah. I also want to mention there is a specific and Louise actually will probably know, acceptance and something else therapy specifically for these kinds
It's
of things
called
that
acceptance and commitment therapy.
thank you, Louise. Yeah, that's what it was.
I'll just write
And for
this
my
in.
you're still talking, Louise. Thanks. Um, I find for me the meditation part is huge. A lot of mindfulness meditation, the different types of meditation are a lot about accepting what is for you. And I believe it's helped me a whole lot for that.
One
Okay.
of the resources we gave you is, can you bring up that resources slide? The Chronic Pain Support and Connections Group.
Mhm.
One of the things they do is they offer free counseling. Um, So you can phone in, it's done like this, it's encrypted, so it's safe. You can have multiple people if you want your whole family there to help understand what you're living with. But that's what they do. They offer support that way, and they offer free counseling and to help you figure out. And these people have been through it themselves. So the main people are one's a doctor and one's a lawyer. And Aisha on the law side can help you with benefits and different things like that. And Dr. Lena, she can help you with that counseling piece, helping you to figure out this new life that you're living that you didn't plan on having.